Okay, so for this workshop presentation, I decided to do emotional behavior disorders. And what emotional behavior disorders is considered an emotional disturbance, which is an inability to learn that cannot be explained by intellectual, sensory, or health factors, inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behaviors or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, a tendency to develop physical symptoms or fears associated with personal or school problems. Some of the characteristics um, and behave and behaviors in children with these problems are hyperactivity, which is a short attention span, impulsiveness, aggression or self-injurious behavior, acting out, fighting, withdrawal, not interacting socially with others, excessive fear and anxiety, immaturity, inappropriate, crying, temper tantrums, poor coping skills, learning difficulties, academically performing below low grade level. Some of the causes, there's no actual cause to the emotional disturbance, but there are several factors such as hereditary brain disorder, diet, stress, family, functioning, and mental illnesses are all treatable. Um, some of them more severe than others, taking more time, but they all obviously can be helped. Um, some of the disorders that I looked at were conduct disorder, which is a group of behavioral and emotional problems in youngsters. Some of the behaviors are aggression to people and animals, destruction of property, deceitfulness, lying, stealing, truancy, or other serious violations of rules. And ranges of services that can help with this disorder are training for parents on how to handle a child or adolescent with this behavior. Family therapy can help. Training and problem solving skills for children or adolescents. Community based services that focus on the young person within the context of family and community influences. Obsessive compulsive disorder, OCD, is considered an anxiety disorder and is characterized by recurrent unwanted thoughts, obsessions, and or repetitive behaviors, compulsions. And repetitive behaviors can be hand washing, counting, checking, cleaning, and they're often performed to help prevent obsessive thoughts or making them go away. And they call these rituals, which can help provide the temporary relief to the person with OCD. Treatments usually consist with a therapist being trained in behavior therapy, cognitive behavior therapy, and medication, which is usually antidepressant just to calm them down and relax them so they're not so obsessed with the thing that bothers them. And then anxiety disorders and depression. Anxiety disorder is chronic emotional condition characterized by excessive debilitating worry. Generalized anxiety disorder is tend to worry excessively about a wide variety of things, including their academic achievement and potential catastrophe events such as war or hurricanes. And then depression is emotional condition characterized by significant sadness, discouragement, hopelessness, and in children irritability. And then this is some support for the emotional problems. With these disorders, professional intervention can be needed, but teachers and adults can offer reassurance, communicate expectations for appropriate behavior, and address children's personal concerns such as getting along with peers and needing to exert some control over everyday situations. If you show an interest in the well being of all children, this can help. Teaching social skills is helpful. Provide extra structure for youngsters who have high levels of anxiety. Set reasonable limits for behavior, give children and adolescents a sense that they have some control, advise parents about their children's needs, and if you need more help understanding the child's disability and how to address the problems that are arising from this, mental health professionals are key components, and there's a network of mental health support in every state, so you can go to them and get help if some of these things before don't work just for you. And also focus on the strengths and not the weaknesses from this disability. And then when you help your children with their emotional disorders, you need to take charge of your child's education, communicate with your child's school, and clarifying your goals, being a good listener, offering new solutions. Don't give up easily, and stay calm and collective and positive. Identify how your child learns best. Are they a visual learner, auditory learner, kinesthetic learner? So you can um, use those ways to help them best because it's going to be difficult with the disability. and think life success rather than school success. Success is different for each person, and it shouldn't just be about how they do in school because obviously it's more difficult for them, or it could be. And so, if you focus on the long run and their success, and it's just pass the report cards, pass the grades, and how they do, it will really be helpful. Emphasize healthy lifestyle habits. Exercise, diet, and sleep are really important because if they have these, they're able to focus more, concentrate, and work hard. And then one of the things I think gets overlooked is really taking care of yourself because these can be really stressful. And if you learn how to manage your sleep and also eat well yourself and exercise and get enough sleep, um, you will be able to handle this more appropriately and you won't be so drained or tired. And um, by you being ready and prepared yourself, it's going to help the child be able to get the help they need in these problems. And if you need help, you can also get help because obviously these problems can be overwhelming. And then these are my resources, and we're excited, but I really hope this is helpful in addressing emotional disorders and really identifying ways that they start and knowing that you can get them help because mental disorders can really be helped. Okay.